Hi, my name is Ricardo Pietrobon, and I am in charge of the work package related to metadata collection for Beacon. Essentially, one of the goals of Beacon is to collect information about databases that might be available about cancer patients around the European Union. Essentially, we have four main stakeholders. So researchers who are interested in things such as administrative databases or cancer registry data. Number two, of course, patients. And patients are interested in terms of where can they find specific therapies or specific diagnostic procedures, specific methods for improving their quality of life or end-of-life care, as well as policymakers. Along the goals of policymakers, one of the goals of the Beacon project is to provide information in terms of hospital capacity, since we believe that that might be one of the driving factors related to healthcare disparities in relation to cancer. We believe that patient empowerment is a very important one. In other words, we're providing patients with the ability to locate hospital facilities and healthcare systems that can provide the best care for themselves. Also, in terms of research enhancement, which is another ambition point related to the EU Beating Cancer Plan, we're providing extensive information about where can researchers find databases that they can use to further the knowledge about healthcare quality in terms of cancer across the European Union. And finally, very important, as mentioned before, one of our goals is to help reduce disparities. At this point, there's a lot of information in terms of disparities in terms of the European Union. So, for example, we understand that there's a significant disparity between Eastern and Western countries. However, there's very little in terms of evidence, a lot of guesses, but very little evidence in terms of what's actually causing these disparities. Is it really related to hospital capacity? And so what exactly, which specific factors? So we want to replace the hot air with some data-driven information. Essentially, we believe that Beacon can be a mechanism for decision support for policymakers and other individuals interested in reducing disparities. As I mentioned before, at this point, there's a general agreement that there is disparity. There's very little information in terms of what's actually causing, or even if causing is too strong of a word, what are the associations between disparities and factors potentially leading towards the disparities. So anyway, we have high hopes for Beacon. We're working hard to make it happen, and we really hope that this is going to bring benefit to the European Union.